Today we are taking, I mean, in some senses, taking stock of what has happened over the course of the past year in terms of policies and practices, particularly around housing first and support for housing first during the COVID-19 pandemic. And with a lot of hope and enthusiasm, looking at what were the good things that happened that we would like to keep as we move forward. What were some things that we would encourage not to happen again, or to put a stop to. And the other thing that I think is really exciting to be able to talk about today, and I hope that Mike will touch on it in his presentation or his comments, is that just yesterday, the European Union launched its first ever EU level platform to combat homelessness, to really recognize that we can end homelessness, but we need to all work together to make the systemic changes that are necessary for that to happen. All 27 member states of the European Union, their ministers signed up to this platform, which in itself is absolutely fantastic and a testament to the work that FEANZA has been doing for a very long time. And so I think the optimist in me wants to see that we're on the brink of a moment where we can all work together collaboratively to do some of this work that we're trying to do within the hub, that you're trying to do in your own organizations and contexts. And hopefully now with this impetus of support at EU level, we'll be able to pitch good ideas, pitch good suggestions to institutions at EU level, national level, regional and local level. So as we get into that, I'll just say very quickly that we're the Housing First Europe Hub, which is a network of organizations, cities, foundations, researchers, housing providers, and organizations like FEANZA and the Y Foundation. We're also represented here by Focus Ireland and Crisis, who will be speaking, and platforms, national platforms like the Dutch Housing First platform, and we'll be hearing from Melanie a bit later this afternoon as well. So we're a network, we're working to promote the shifting of systems to end homelessness and prevent homelessness by scaling up housing first. And we work on research, on practice, setting up communities of practice, and on training. I'm one of the two coordinators. I'm based in Brussels, and my colleague Tina is on the line, and she's based in Helsinki. And today's session, we'll be looking at the results of a survey that we conducted. We'll be having a reflection from national level from the Netherlands. And then we've asked Mike Allen to give us a sort of a nice political synthesis of what we've gone through in the past 15 to 18 months. And then at each stage, we'd very much like to engage with you and ask you to ask your questions in the chat or in the question and answer section. And we'd very much like to have a discussion and a debate. So please feel free, maybe use the chat to let us know where you're dialing in from or you're viewing from. And also really don't hesitate to ask questions. And we hope that this will be a lively discussion. So with all that done, I will hand over to Francesca, who leads co-leads our research cluster work that we do here in the hub, and I'll ask her to take us to her presentation.
Thank you, Samara. So I'm just going to upload that now. So what I'm going to draw on is results from a very short online survey that we conducted. And we started this in January, so it is over a number of months, I suppose, just to put it into context. And it was in response to a conversation we were having around to what extent we were understanding what was happening across Europe in terms of responses to the pandemic, both in terms of housing first provision, but also around homelessness more generally. So homelessness funding, homelessness services. And I suppose I want to caveat the presentation with the fact that it's not intended to be an in-depth piece of research. It was very much some sort of short, mainly closed questions where we were trying to gauge what was happening within different countries, and also understanding a little bit around the kind of context around that. So we got 22 responses the survey, and we asked mainly closed questions which were on a scale to give a kind of opinion around kind of what was happening in terms of different elements of housing first provision funding and wider homelessness services. And these represent responses from 18 countries. And where we've had duplication is where someone has responded either from a particular city level where there is a large number of housing first units, or more in a kind of regional jurisdiction where there is a slight difference in terms of what the country provision is. So we have included those, but it's just to give you a bit of context. I'm also just going to draw on some basically some kind of literature that has been done over the last 12 months as well around provision of services. Not huge amounts that's been published because of obviously the time frame we're talking about, but I think there's definitely kind of other studies we can draw on. So just to begin with, we did ask about kind of whether or not respondents felt that the overall funding of housing first services in their country had changed since March 2020 and the start of the COVID-19 crisis. Obviously that's differed from different countries in terms of when governments went into lockdown situations. You can see there, majority of respondents sort of commented that actually it had remained reasonably steady. That was the kind of majority. There's a couple of responses where it had reduced, and 2 where it had kind of significantly increased, 4 where it had kind of slightly increased. We then asked about overall funding for homelessness services because we wanted to contextualise the provision of housing first and funding for housing first alongside what else was going on. So you can see there that actually that gives a slightly different picture in terms of kind of overall homelessness provision. So you know, on the whole, we have seen a kind of increase in terms of funding for homelessness services. And I think that I'll come on to talk about it a little bit more, but I think it kind of places the kind of, I suppose, how housing first is positioned and funded within the context of overall homelessness services. I think, you know, it is also because the pandemic and other studies have kind of noted this as well, has provided swift action within a homelessness context, often where kind of emergency provision has been provided in a number of countries, both in terms of getting people kind of off the streets very quickly, those that were rough sleeping at the time the pandemic hit, but also new flow onto the streets. So either that through extending kind of emergency shelter accommodation, a combination of shelters and self-contained accommodation, and in some countries actually only kind of shutting down shared kind of night shelter facilities and shifting provision to procuring emergency accommodation, whether that be B&Bs, hotels, other forms of self-contained accommodation. So I think what we've seen is, and you know, this in terms of other studies as well, is this kind of, there was quite an increased investment overall in homelessness services, but we're not necessarily seeing that relating to the kind of housing first funding side. So we also asked a question about provision as well as funding. And you'll see that it kind of, as you would expect, mirrors the results that we got around the funding as well, that actually it's remained reasonably steady. So we haven't seen a particular reduction in housing first provision, but we've not necessarily seen a huge increase either. Obviously, there are some countries where it has increased. And I think what we then wanted to understand a little bit is where the kind of housing first kind of investment sort of is situated alongside kind of other provisions. So I mentioned before around we've obviously seen quite a lot of increase and kind of investment in particularly in emergency accommodation, whether that be communal or self-contained. So we saw, you can see there in terms of the kind of results from the survey, that quite a lot of the time, you know, a lot of people, it was temporarily introduced. It was still in place at the time when the survey was done, so that's been over the last 6 months, but actually in a lot of cases, respondents also said that the kind of increased emergency accommodation will remain in place sort of beyond the pandemic period. I think that the other area that's clearly, you know, has kind of been quite frequently introduced in a lot of countries is the suspension of evictions. So that intervention by government to prevent homelessness from happening. And, you know, we're starting to see that wind down. So nobody said it would be a permanent kind of policy intervention, which, you know, understandably. But I think that's one of the areas where I know from other studies as well, it's a risk area in terms of the worry of what's coming next. So Crisis funds a kind of a GB-wide study called the Homelessness Monitor, and that was one of the areas that was really picked up in the local authority survey and interviews that we did. This kind of real concern about kind of what the banning, the kind of eviction ban coming to an end was going to mean. And I think, you know, we've also seen kind of job retention schemes sort of being used quite considerably as well. That again has, I suppose, is part of that package of prevention. If you're kind of maintaining people's income, there's also a kind of a provision there in terms of ensuring, you know, people are still able to pay their rent and mortgage. And then I suppose that in addition to that, you know, this idea that there's been additional kind of welfare benefits introduced in lots of countries as well to prevent homelessness. I think the other areas we saw sort of quite a significant difference in terms of homelessness provision is an emergency response for people with no recourse to public funds. And I think that you can see there that obviously that was in place for many people and was going to continue, but I think again, interestingly, nowhere sort of said it's going to happen on a permanent basis. And I think again, that's another area where you know, we've seen quite a kind of, you know, because of that need from a public health perspective, to make quick interventions, that also included people who had no recourse to public funds in many countries. And actually we're now at the point where, you know, why shouldn't there be sort of increased provision, you know, to protect everyone? And actually I think that's one of the questions in terms of should we keep, what's the good stuff we should keep going? That should, you know, definitely be part of that. And I suppose I just wanted to sort of point out that, you know, in terms of the increased investment in housing first, how that fits into the sort of suite of different policy and practice interventions, that there is a kind of a positive sort of area here in terms of that, yes, 18% of respondents, so that's not huge amounts, so we're talking about a few countries here, say that the increased investment in housing first will be permanent. So it has, you know, the kind of the pandemic and a kind of move to looking at housing first as an intervention will be made permanent, and was kind of introduced as part of the pandemic response. But I think, I suppose it's to put it into context that, you know, similarly to what I was talking about before, that actually, you know, as a lot of other literature has pointed out, you know, it's more like there's been more kind of investment in emergency provision and temporary accommodation to be permanent features of the sort of homelessness system, rather than housing first per se. So I think that is sort of something probably, you know, worth kind of thinking about in terms of what do we want to create in terms of a kind of permanent kind of solution to ending homelessness. And I think just a few points in terms of housing first provision itself. So we did also ask some open text questions, which kind of gave some quite interesting insights into kind of what was going on. And what we found from those, and this also again mirrors other literature that has been conducted over the last 12 months, is that changes have been very much dependent on the pre-COVID context. And the idea that the kind of, the context and scaling of housing first is very much dependent on what was going on before. So, for example, there's been very little change in Finland due to the pandemic because there was such large provision of housing first already in place. And there were very few people kind of needing that kind of more emergency provision. So the small changes happened, including a quarantine provision. But that's because of the kind of context that was already in place. And we also found that, there were comments that funding in many countries had been for emergency provision and support rather than for permanent housing. So that was definitely the responses we got back from England, Spain, Denmark and Belgium particularly pointed that out. The other sort of area that was talked about a lot in kind of some of the open text answers is that the housing market has been cited as a large barrier to be able to shift from this emergency provision to more permanent housing. And again, that was particularly noted in responses from France and different countries in the UK that responded. And that's not a surprise at all in terms of this comes up repeatedly. It won't be a surprise for most people on this webinar. I think when we did a study around housing first provision in Europe that was published 2 years ago, and by far the biggest barrier challenge is housing and access to affordable housing. That hasn't changed. In fact, in some kind of ways, it's got worse because of the kind of competition for permanent housing. And then, I think the other thing is that whilst we talked before about housing first staying sort of relatively steady on the whole part in terms of both funding and provision, actually we did sort of get responses around maybe housing first programs being extended. So that's whether that's funding, timescales being extended or speeding up the kind of upscaling. And that was again noted in responses from Poland, Ireland, the UK and the Netherlands in terms of what was going on around housing first provision. And I think, one of the other areas we sort of asked is around staff capacity and expertise, particularly within kind of housing first context. I know a lot of services, homelessness services in general, have moved to more remote provision, and I think there has over the pandemic, particularly at the beginning, was a bit of a concern around if you're working with, I suppose, more vulnerable people with higher support needs, what that means. And so what our kind of responses show is that there's kind of the staff expertise were there, but it was about the kind of capacity issues as well, and aligning that with kind of with other studies as well that's looked at kind of homelessness provision more generally. That access to housing again is sort of seen as one of the most difficult areas in terms of being adequately equipped, but there were also kind of issues around access to relevant health services and drug and alcohol services during the kind of pandemic period, particularly for housing first clients and services. And I think one of the things just to kind of think about there is where, if we're talking about health, given the pandemic is a public health emergency, I suppose thinking about, are there any other opportunities in terms of the focus on health and the links to housing and homelessness being something we can build on, particularly in terms of the client group we're talking about and people who are in housing first services, actually having better access to that. So I suppose just very quickly, just to sort of end on, I've kind of talked about these a little bit already, but the kind of some of the things that came out of the responses, and kind of again it echoes kind of other evidence, is that kind of particularly the challenges are housing supply and allocation of social housing, in particular, that there's been a lot of competition at the bottom end of the housing market, and that often, you know, if there are other homelessness services needing housing as well, not just for Housing First, that there's often a bit of competition in terms of how to get access to that accommodation, alongside obviously other people losing, you know, reducing their income and maybe needing to move to kind of lower rents. I think the other thing that came out is the kind of bureaucratic delays in funding and administrative burdens in terms of what was needed if there was extension or speeding up of Housing First, but actually the pace of implementation couldn't match, was higher than the kind of administrative burdens that played out. The kind of link to that is this there was commentary around the kind of coordination being between central and local government sometimes being mismatched, and that causing a challenge in terms of making sure things were upscale quite quickly and kind of responding to local need. And this idea that kind of transition to remote services and getting guidance on safe face-to-face work, which was has been vital during the pandemic, particularly for Housing First services, was quite difficult at first, and getting the right guidance and knowing how services could respond to that. And in some cases, respondents said that it had led to repeat homelessness. So I suppose that's kind of another challenge. So that's it. I mean, I think I just wanted to end on, and, you know, obviously Melanie and Mike can pick this up, but, you know, there are challenges, but they're not insurmountable. And I think there's lots of things that can be built on and overcome. And I suppose a kind of sort of open question is around what we learnt, and also that, you know, how can we embed Housing First in a more systematic way, so it does become more part of the solution, that kind of faster pace implementation that we've seen over the pandemic in some cases, and that kind of extension of funding is more permanent. And I'll stop there.
Wow, thank you, Francesca. It's fantastic to be able to have at least a snapshot from all of these different places, because I think that's something that we all feel like maybe what's happening in our context is very different when what's happening down the road or across the border. But I think it's interesting to see that there's quite a lot of common threads that have come through in the research. And so thank you for going into that. There was one question, or a couple of questions coming up, and I wondered if maybe we take about a couple of minutes just for questions on this part of the webinar before we go on to the next bit. I'll just see. The first question I can answer is the slide presentations. We can definitely send them out. Certainly, we will post this video online, and we can make the slides available. Francesca, I don't know if you can answer this question about Finland, or if we can ask. We can probably find a Finnish person on the call to answer it. Otherwise,
I feel like I can see a few Finnish people on the call, so I don't want to, because the questionnaire was so short that I don't know whether if anyone else wants to kind of type in, just because I don't want to kind of make a sweeping generalization on behalf of a country I don't live in.
Yes, so I will ask that at least one or two of the Finns, if you could use the chat to maybe answer this question, is how did Finland experiences these challenges listed for Housing First? It would be, maybe you could type in a couple of sentences for us. That would be great. I don't know if there's anything else. I haven't looked at the chat if there's anything else that has come up, but if there's other questions, please do put them in the chat or in the question and answer, and we'll be monitoring that as we go along. And so, thank you again, Francesca, for that part, and we'll bring you back probably for the discussion at the end as well. So I'll now pass over to Melanie. We've asked Melanie to speak to us with a perspective from sort of that national level of trying to articulate some of the things that you were mentioning, Francesca, that link between the national level, the local level. How do you make sure that those relationships or procedures or guidance are aligning and working? So Melanie, can I hand over to you?
Yes, thank you very much. Hi, everyone. Thank you for giving me the opportunity to say something from the Dutch perspective, because although we are miles away from each other, we now share a moment to reflect on what COVID did to our mission to make a better world and to end homelessness. And we all, I assume, are strongly convinced that Housing First is the best model to do so and needs a strong foundation for upscaling in Europe. So again, I am honored to share our reflection and insights from the Netherlands. And as was said, I'm Melanie Schmit. I'm the president of Housing First Nederland. So our challenge is to promote change and make it easy, because the Netherlands is slowly opening up again. Gyms, zoos, restaurants, soon working from home will no longer be mandatory. A good time to look back and to also look ahead. Questions raised while reflecting on COVID and our process of upscaling of Housing First in the Netherlands are, do our actions and communications have the impact we wish for? And should our attitude and the way we propagate Housing First be more in line with the way we also deliver Housing First? So based on hope and trust. And what lessons learned from the COVID chapter can we use in our future approach? We found the following considerations for our future approach. The first is we were positively surprised that so many people showed their will to contribute to society and help each other out during the pandemic. It fueled our belief that everyone longs for a better world. The second thing is that while the average citizen does not commit to take action for entire groups of or large-scale problems, we saw that a lot of citizens made an effort for a few individuals in their immediate vicinity. And of course, the third, again, we saw that Housing First is the best solution to keep safe and has potential for huge change in the Netherlands. Housing First teams, that's the fifth thing. We also saw that Housing First teams were so ingenious in their work and adapting to the measures, staying in touch with participants and making sure their recovery was disrupted as little as possible. And the fifth thing is we saw policymakers and other stakeholders react strongly to risks. So we should continue to appeal to this in the future. We concluded, although we have done good work and are well known, Housing First is still far from reaching its goals. Great strides has especially been made for people experiencing homelessness in emergency responses during the pandemic. Short-term measures, resources and policy were suddenly possible. The reform of shelters, new forms of social benefits, a ban on evictions. But unfortunately, it's equally noticeable that with the reduction of risk and the lifting of the measures, the issue also loses momentum. And some of these specific interventions on behalf of the pandemic have already ended. And above all, there is another area where no progress has been made. It's increasing the number of affordable permanent homes. Despite of the fact that COVID has made the importance of housing so painfully clear, there has also been painfully little progress in this area. In the beginning of 2020, we were all confronted with the first signals of COVID, the first infections, the first measures, the first lockdowns. And some of us may have had COVID ourselves or know relatives who had. Maybe you've even lost a loved one. Maybe you still suffer the consequences of COVID or whichever they may be. And we saw people being scared and collecting crazy amounts of toilet paper all over the world. We were all hit by the not knowing of what was going on exactly and how it would maybe hit our lives in the near future. We saw people reacting differently, but mostly we saw people starting to help each other and a government doing the best they can to support stability, safety, and finding a way towards solutions. And our government introduced the motto, only together we can get the virus under control. And people were kind of delighted to help each other. And everybody felt deep down, we are connected and we are dependent on each other. Groceries were done for neighbors, some cooked meals, songs were sung through open windows. There was a new solidarity, which felt like a precious side effect of the pandemic. And as Housing First, we saw that just like us, most people want a compassionate society. So we, Housing First Netherlands, saw on a large scale that people do want to contribute to better the lives of others when something can be done in a very targeted and manageable way. When everybody needed to stay home, the Netherlands woke up to the reality that some of our citizens don't even have a home. So the government and the organizations arranged, like was also said in the previous presentation, for COVID-proof shelters with private rooms, 24-hour access, additional shelter. A lot of work has been put into this. Certainly because of the waves of infections, also the money and the measures were constantly going up and down. Now we know that the amount of homeless people that actually got infected was very low, which surprised me, to be honest. It was easily imaginable that it would have gone a completely other way. People living on the streets cannot easily protect themselves and are more vulnerable to diseases. But policymakers and the shelter workers saw that the privacy of the reformed shelter did a lot of good to most of them. Staff reported that they could have totally different conversations with people than before, and that people were more able to look to the future. They reported that it was incredible to see what a little peace, privacy, and personal attention could do. And for us as Housing First, of course, that's a no-brainer. Just like Samson Barris said, in a strange way, the virus made the point that we, Housing First, have been making for years. Give people a place to live. It's safer, it's more humane, and it's healthier. It awakened the fact that homelessness is a problem for public health, not only for those who are homeless, but for all of us. That was always the case, but COVID made it clear. When the risk was more urgent and clear, actions were taken and money followed. And besides washing hands and wearing face masks, a house turned out to be the precondition to keep safe and healthy. The Housing First teams also turned out to be very well equipped and adaptive towards the situation. They showed to be flexible, creative, responsive, and remained hopeful and optimistic. Although they had to adjust in the beginning, they kept meeting participants in ways that were possible, and it was clear that this was essential and necessary. And they did it by online calls, text messages, videos, meetings outside, bringing things to counter boredom and loneliness. Housing First teams did whatever possible to keep the recovery of participants going, and were quite successful in doing so. The conversation in the Netherlands about COVID and homelessness cannot be seen separate from the fact that there has been increasing homelessness and a housing shortage for years. It takes place behind a background of many long-running policy discussions about reducing homelessness. People experiencing homelessness have indicated for years that their primary need is to have their own place. It's been said before, but the pandemic has been like a magnifying glass. Aside from the pandemic, the national government had already given extra money to local authorities to prevent and end homelessness. And several were in a stage of developing or implementing Housing First. Of course, the pandemic powered the urgency of it all, but the development takes time, and the housing crisis makes it really difficult to speed things up. Now the third wave is coming to an end. Vaccinations are going rapidly, everything is going back to normal, and freedom of citizens is increasing fast. So the atmosphere is very delighted, but not for everybody. As the extra shelters are closing, it means that some people wind up back on the streets, just like that. And it shows that we have not yet made the risk of homelessness to society sufficiently tangible. But with the lessons of COVID in mind, pointing out risks will definitely be our focus. And to conclude, numerous studies show that human compassion begins to collapse when we are confronted with too many victims. As Stalin once said, one death is a tragedy, 1 million deaths is a statistic. For example, doing groceries for the neighbor was widely done during the pandemic, but would we ask the same person to organize a campaign for all the elderly in the country who needed groceries? People get overwhelmed and they pull out. This is an important insight for how we try to mobilize professionals and public for Housing First. We need to create opportunities for them to contribute to the Housing First movement in a manageable and targeted way. And while overthinking this piece, we've come to conclude that we should take the active elements of Housing First and the way of working with people into our advocacy. a refreshed message based on hope, trust, positivity, and connectedness in our communication strategy. Nevertheless, creating a sense of urgency through appealing to the risks of homelessness, making it just as obvious as the risk during COVID. Furthermore, we should make it even more possible to participate on every level, from citizens to businesses to governments. A message that makes it a small step to contribute to us and our movement, but because we realized again that everybody longs for a peaceful and stable and social society. And we as Housing First hold the key to how we can actually make this happen for the most vulnerable group, and therefore for all of us. And we are available to share the tools and to make this drastic positive shift, just like we do on an individual scale with our participants. We need to share our stories, live our mission, and have an unwavering confidence in ourselves and in each other that we will reach our goals. So let's promote change and make it easy for others to join us. Thank you.
Thank you, Melanie. That was really great. Thank you for taking us through the learning from so many different perspectives and really thinking about how it affects the people in the Housing First, the teams, as well as that potential for sudden change and that potential to connect to I think that public health angle is something that we've learned from many contexts, many places, and I think it's something we should definitely not forget as we go forward. But thank you. I don't know if there are any specific questions for Melanie now. Maybe feel free to put them into the chat. I don't see any right away, so maybe we'll come to those at the end, if that's all right. And I'll just pass on to Mike Allen, who is I always get it wrong. Is it head of policy and you'll have to introduce your own title. I'm sorry, I always get it wrong.
Director of Advocacy.
Director of Advocacy.
Research and Communications in Focus Ireland in Ireland. We're one of the leading housing and homeless organisations in Ireland and running Housing First for at the moment, and it's part of the National Implementation Plan in Ireland, but running it for best part of a decade in different sort of ways, and very active in the hub. I think it's a really interesting, important piece of research, and thanks to Francesca for the work that went into pulling that together and the clarity of the presentation, because certainly all of us who've tried to look at what was happening during the crisis, one of the barriers was that everybody was too busy to fill out questionnaires. So fair play to people who did fill them out, and fair play as well to the people who badgered them into doing it, because it is really, really important to capture that, and show what is there. It's a snapshot, as Francesca said, of a particular time of what I think probably when we were doing it, we hadn't realized was going to comprise of quite so many different waves and recurring sort of series of anxieties and sort of no sooner are you preparing to what you're going to do next, when you realize that you aren't going to be doing that next, you're going to be back to what you were doing before in different ways. And I think that's so there's something to be said for keeping on looking at it. I know, I'm sure that the people involved in the research probably don't want to hear that, but one thing that we did similar work in looking at all our sister organisations providing Housing First in Ireland, looked at that collectively in terms of our response. And one of the things we're very interested in doing, but know the barriers to, would be, wouldn't it be interesting if we could undertake some sort of research project to find out what the experience of Housing First tenants was during that period and how they experienced the pandemic. I don't underestimate the methodological difficulties in doing that, but it would be fascinating to understand that more deeply. And one of the things that really comes out to me, I think, both from the research that's talked about there and anybody talking about the experience, first thing is the extraordinary reaction of the sector, our sector, the homeless sector. I mean, and certainly in Ireland, this was really commented on about the way in which we were able to really rapidly respond to completely unprecedented and extraordinary circumstances. And like Melanie was saying about in terms of illness and death from COVID in Ireland, we have an extraordinary record in terms of keeping people who are homeless in general safe during COVID, and people in public health have a huge role to play in that, but right across the sector we had a role to play. To some extent, when you look back from it, it is, and it has to be celebrated, it has to be remarked on and recognised the way in which our staff continued to work, frontline staff continued to work when so many other people were working from home. But at another level, shouldn't be surprising, partly because of the quality of the people that all our organisations employ. But we are crisis services. What we do is we think of homelessness as a crisis and we respond to it as a crisis. And one of the sort of, I don't want to be negative, but by any means, but I want to sort of balance the debate in terms of being too sort of naively optimistic, is that one of our problems as a homeless sector is that we're too good at dealing with a crisis. We like crises, we're good at them, but the actual long, slower slog of actually turning this from a crisis into a solution is something which I think we've got to learn to do, and we've got to reflect on that. How do we need to change in terms of being more solution focused and less crisis focused? I'll come back to that. One of the other things, as well as the overall sector being resilient and responding very effectively, was from our own experience, particularly during the first lockdown, there were a huge number of mental health issues amongst people who had formerly been homeless, and right across the homeless sector. There were mental health issues amongst everybody, so it's certainly not unique to people with experience of homelessness, but certainly people with existing mental health needs and trauma who were homeless. The experience of homelessness could be very, very, very negative. And mental health issues and suicidal attempts and so on were quite a significant part of our experience. And one of the things which I think you really need to say in that is that of the services which were best able to deal with the challenges to support people who were homeless or had come out of homelessness, Housing First services showed their value. They showed that the Housing First services were dealing with the people who were most likely to have trauma influence responses to what was happening around them. And they had with them, though, the capacity to provide people the support they needed to deal with those. And I think many of the people who are in Housing First services, it's not just that they had a home. I think that the psychological effects of certainly the first phase of lockdown would have been far more damaging and have long-term consequences on them, other than without the fact that not only had they had the home, but they had supports that come with Housing First, and the trauma-informed and the psychologically informed responses were there. And I think that was extremely, extremely important. I just really think Melanie's reflection there on the solidarity and the collaboration, I think, is really, really important, and is very much a very positive element of what happened. And it's understanding what happened there is really important to link to having it continue. And I think the insight that it's the capacity to do the small things in your community with people who you may not know, but you know live near you, you have some sort of link with, is the way that we can continue some of that. But I think we also need to recognize that there were two really strong strands happening during the process during the COVID crisis that continue. One is that sort of solidarity, the community responses, and all the things that Melanie correctly talks about. But having a more negative, a darker disposition, I also want to mention that the very rich became extraordinarily very richer during that process, that house prices did not fall, that if there hadn't been eviction bans, there are people who would have evicted their tenants during that period of time. And so there's another section of society which pulled more into, if I'm going to survive this crisis, I'm going to look after myself and my family and not help other people and amassing their own needs. I think we need to recognize that they exist too, and we need to make sure that those sort of, and not because it would make us depressed, but because I think that sort of realistic interpretation of the different responses of human beings to the crisis helps us better to do the sort of things that Melanie is talking about, to be positive and hopeful in a way which recognizes the challenges that we're up against. The sorts of collaborations I think are interesting, and one of them was about the overcoming of bureaucracy that comes up in the survey that Francesca was talking about, the removal of red tape our people talked about. And I think that's something that we really need to work at to make sure is continued at a very practical day-to-day level. Now, some of the red tape is the sort of thing that prevents friends of cabinet ministers suddenly becoming very rich because they're able to sign contracts that to provide things that they have no knowledge of. So those sort of protections shouldn't be seen as red tape, but the sorts of things that required you to fill in a whole dozen of forms, which are often got rid of in circumstances, are things that we really need to look at. If you can do things and you don't waste public money during the crisis, what of those processes will continue? The second one was, I think, which hasn't really been mentioned, but is the changes in the housing market. And I'm sure this was different in different areas, but one of the experiences that all of us have seen a narrowing of housing supply in the private rented sector as Airbnb and similar sorts of vacation housing moved in to capture houses that had previously been available in the private rented market. And the closure of that, sudden collapse of that, made some housing available which hadn't previously been available. That was a big significant factor in some areas in Dublin. Most of it didn't become long-term housing. It didn't return to the private rented market, but it did provide a much higher quality of emergency accommodation for the families that we have that are homeless. And the other factor here, which would be interesting, was changes in patterns of work. So in Dublin, huge pressure on the housing market. A lot of that is often single but young non-Irish workers who were working in the high-tech industries in Dublin and were previously lived here and had to pay very high rents, but also put pressure on the rental market. The fact that many of those returned home and are now working remotely will have changes in the housing market, which only time will tell. It's not that. I mean, in some countries, France and so on, there are considerable amounts of housing which are outside the urban areas. But I don't know about the availability of those in France, so I'm not saying that's the solution in France. But in many other countries, in actual fact, there are tight housing markets everywhere in the country. So simply people being able to work from a smaller town won't solve the problem, though it might solve theirs. But that's going to be something that we need to look at. I think the question of what happened with the money is really where I'm going to close off here, is that what comes from the survey is, and we know in general, all our governments spent huge amounts more money. And many of the things they did in homelessness were good, short-term good things that we're very, very grateful for. But it is striking that there wasn't a significant shift right across the board in terms of the investment in housing first. And to me, that comes back to this question of, well, what you do in a crisis is what you're familiar with doing. So the way that people responded to homelessness was very much reflected what they thought of and understood to be the nature of homelessness that they were responding. And that goes back to the heart of our problem, that if we understand homelessness to be about, well, there's this group of people who have personal problems and their mental health issues and drug addictions, and really they're sort of stuck in that, and we have to sort of pluck them out one by one in specialist programs. We can't be very surprised that when a crisis comes along, we don't get the sort of systemic response of investment in long-term solutions that we were hoping for. And this is where there are additional reasons for hope, because I very much agree with sending the message of hope and what can be done about this. So I think largely coincidentally at this point, we have the signing of the declaration by so many European countries. And we have governments who haven't been talking about ending homelessness for a long period of time, saying they're going to end homelessness and they're going to work towards homelessness and they're going to have targets to do that. And so that's the sort of collaboration that Melanie was talking about at a community level, and comes from the survey that Francesca was talking about, being this link between local and national government, writ much larger in terms of, we often talk about what do we need to end homelessness? It's political motivation. Well, this is sort of what political motivation looks like. This is, well, one of the aspects of political motivations is ministers signing things and talking about things and agreeing to share experiences and so on. And what our job, I think, is to is to make sure that Housing First is at the heart of that. And that's Samara's job, but it's all of our jobs to make sure that when all these governments say, well, look, across Europe, and I hope that will have knock-on effects on a wider level, say, this is a problem which we can actually solve, that Housing First is absolutely central to that. But we don't mean, well, we do mean that Housing First is a program. Housing First is a funded program, has a beginning, a middle, and an end to it, is part of that. But we mean much, much more than that. We mean that the understanding of homelessness, which informs Housing First, becomes the understanding of homelessness, which informs the entire housing and homelessness system. And that's the systemic change we're talking about. It's not just about scaling up, it's about changing the way that we respond to the issue. And I do think some of the lessons, that so many of the lessons in terms of what worked in a long term, we can't tell what worked on a long-term basis out of COVID yet, because it hasn't happened. But there's continued research and saying, well, actually, this was what appeared like a short-term action and it went nowhere. And this was what appeared like a short-term action and it actually had a long-term effect. We will find the ones that had a long-term effect are much more like the values and the principles and the practice of Housing First. And we need to document that and show that it's not just crisis reactions to deal with the immediate problem, but crisis reactions with urgent reactions informed by a deeper understanding of the nature of homelessness, how it interacts with the housing system, but also with the social system and the mental health system and public health, that will actually be the long-term positive legacy that we need to fight for and make sure is a central part of this new European movement.
Wow, thank you, Mike, as always, a tour de force. And I think absolutely crucial to point out, yeah, what is it that we are able to do, and how do we, or this is the question I keep coming back to do this job that you so rightly thrust upon me at the end there. But how do we communicate that? And I think communicating that and communicating the possibility around systems shifts, around moving to finding solutions to homelessness that put Housing First at the core, that this is something that we all can do together. And I think having these sorts of studies really helps to articulate that. It gives us something to be able to look back on and say, you know, this is how it looked in all of these countries during the pandemic, and here are some ways forward with that. So I think that that's really valuable advice and very helpful. I think, yeah, just to say that I think that the piece around housing, that was something coming up. We've been having some sessions over this past year on Housing First in smaller towns and rural areas, and indeed they are also feeling pressure in their housing markets, but also in their ability to provide support to people who find themselves there. So I think it's a question for the big cities, but it's a question everywhere. So when we're talking about Housing First, I think it's also important to recognize that housing question is often the same everywhere. And I'm really curious to see how it is all going to sort of pan out around Airbnb and these big players that have been in the housing market and taking up so much space, relinquished some of it and are now coming back in. It'll be it's interesting to hear that there hasn't been sort of a bigger share of permanent housing coming back from that yet, but maybe, well, we'll have to find other ways to get more social housing available. So I was going to just look at the questions. There were a couple. One is asking about, and maybe I can put it to everybody and jump in, please. So when the access to housing was increased, was there opposition from neighbors where Housing First or COVID or shelter accommodations were opening? There's this NIMBYism, which happens everywhere. And the questioner Sharon is saying that it's particularly an issue in Canadian and Ontario communities. I don't know if somebody wants to come in on that.
It's not something I'm aware. I'm going to say I'm not aware of it, but I don't feel like I'm then close enough to, kind of particular provision. I can only, and also I was just thinking about it from a UK perspective, because a lot of hotels were procured, which are obviously then in kind of, I suppose, areas where we probably wouldn't have normally had kind of supported accommodation. But the neighbour thing hasn't come. I'm not aware of it, but I then couldn't say either way.
In Ireland, it definitely was a feature in some places. It's easy to get these things out of proportion, because a neighbour who is complaining takes up an awful lot more of your time than 10 neighbours who are helping out. So it's easy to lose proportion. But one of the factors was that the neighbours were locked in and staying at home. So they were much more likely to observe the behaviour and activity of the Housing First tenant, and perhaps had nothing better to be doing than complaining about them. And one of the negative features of, I think, the process is that one of the ways people sort of express collective views was to become quite judgmental of other people. I think every country saw a bit of that, and some neighbours were quite judgmental of tenants who are in Housing First services. But overall, that's a small number of cases. Overall, people responded very positively and looked after their neighbours, their Housing First neighbours, as well as their other neighbours.
Thanks, Mike and Francesca. There's just one more question. Well, there's a couple more questions. And one is a more general question about how do we support the systemic and cultural change in implementing Housing First? And so it's a little bit beyond the scope of the whole webinar, but I don't know if anyone, I mean, that's sort of what the essence of what we're trying to do here is to create and make available data and learning and sharing to be able to foster that systems change and to be able to support it with evidence. So just to is it Carl Samuel who's asking, I think this is something we can also point to some resources we have on our website, but we know that it's not an easy thing, and it does take time. I mean, Finland is of course the best example, but I know maybe Melanie in the Netherlands, you could maybe say a little bit about your work in the network, in the Housing First Netherlands network.
Yeah, could you repeat the question? It's about the systemic change and how to go about it for Housing First.
Some of the challenges that countries have faced in creating a systemic and cultural change to implement Housing First.
Yeah.
So it's a very
yeah, thank you. For the Netherlands, the biggest challenge is that we have a decentralized government. So for us in every municipality, we have a different situation, so a different way that we can implement Housing First. That is something that makes it very difficult to speed the upscaling up of Housing First. So we would really like a national program like they had in Finland, for example. But we are we've created the network, the Housing First Netherlands network, so that we can at least connect all the different practices that there are in the Netherlands, also create knowledge, do research. It's very similar to the Housing First Europe Hub, but then on a national scale, and also do advocacy and hope to come to more national guidelines around Housing First and a more uniform way of developing Housing First, and also of course speeding things up and to get to a more speedy development of Housing First.
I wonder as well, Samara, whether it's worth just obviously that question links in with the other piece of research we're doing at the moment, which so we're doing a piece of research with Demos Helsinki around situating Housing First within a systems fidelity model and looking at what it takes to kind of ensure that Housing First is part of a systemic solutions to systemic change in homelessness. So I suppose it's watch this space on that one, because we're looking to have that published sometime in the kind of autumn, alongside some kind of practical tools as well, which will hopefully sort of then support other areas in terms of thinking about this as well.
No, that's an excellent note to end on. Indeed, that we know we need to work towards this, and like Francesca says, we'll have these tools available and ready for discussion and debate for you to use them in your own context, but also to feed them directly into, as Mike was saying, into this new sort of momentum at European level, to be able to provide this EU platform with the tools and suggestions for how to really put Housing First at the core of this new commitment to actually ending and preventing homelessness. And to that end, we'll have the papers, but we're also looking to have an event next spring as well. So again, watch this space. So I don't know if there are any other questions. I think we've addressed them all. I was just going to see, does anyone have any other closing remarks they'd like to make? And if not, I will close. But I think I would just to thank this presenters, to thank Francesca and Mike and Melanie for taking the time we're all busy with Zooms, we're all busy with meetings and so on, but I think it's really very helpful for me and for everyone listening to have this moment to reflect back on what has happened and to really take a moment to think about, what did we do well? What can we build on? What can we make sure we try and avoid as we go forward? And I think we don't always take time to do that. In the old life, we would have conferences or meetings where you could kind of go away and get fed with new ideas and get enthusiastic about things. And I think it's nice to carve out a bit of space in our day to think and reflect. So thank you very much for that. And thank you to everybody who was here and is joining us online.